Good morning, everyone, and we are now live. I am delighted to be hosting the first webinar from SR UK in recent times. I'll just give everybody a moment or so to join us. I can see so far we have 18 participants and it's growing. So far 15 attendees and it's growing. So hello to everyone. Hello, Bridget. Hello, Cara, Charlotte, Chris, Christine, Elaine. Hello, Gemma. And of course, we are also joined on screen by the very popular Dr. Francesco Delgado, who I'm very pleased to have with me today. We'll just give a few more moments. Good morning, Francesco.
Good morning.
How are you doing?
Good morning, Zubair. Good morning, everybody. I see that it's a growing number of people.
Fantastic. It's a pleasure to have you on, Francesco.
Thank you. It's very nice of you, SR UK, of having these initiatives. I think there is quite a bit of interest in how we can adapt best to these times.
Fantastic, fantastic. So the agenda for today will be, the webinar will be in two parts. The first part will be looking at the topic of navigating COVID-19 in the current landscape. And that is a question that Dr. Francesco Delgado will be looking into. And the second part of the webinar will be looking at getting the most from your virtual appointments. And that's something that our expert speakers, Louis and Jesse, will be looking at halfway through the Zoom webinar. So each of those two parts are then split into two parts, where the first half is a presentation from our expert speaker, and then the second half gives you all an opportunity to get involved with a live and interactive Q&A sessions, where you can then pose your questions to us, and I can then pose those questions to Francesco, and then afterwards to our other expert speakers. So Francesco is somebody who doesn't really need an introduction. He may be some of your consultants, and he's someone that leads the Raynaud's and Scleroderma program at Leeds University. So without further ado, I'm very pleased to hand over to Francesco.
Thank you, Zubair. So let's share this screen here. Okay, so, and Zubair, you tell me where the things go wrong, because for now I just see my screen, yeah?
Fantastic, Francesco.
Okay, so as Zubair mentioned, I was asked by SR UK and by Sue at SR UK to have a 15-minute chat of how we could understand, how we can navigate the landscape of COVID-19. And I like the word landscape because it's something changing by the week. There were some questions that some of you have asked, and we built a 10-15 minutes presentation around that. Of course, we will have 10-15 minutes after, either for clarification or for any other questions, and I hope I'll be able to answer. So one of the first questions was, what can patients expect in terms of testing that should be taken in place? So there is this testing going on, and our government has changed a couple of strategies about it. Is there anything specific for people with Raynaud's and Scleroderma? And I put this first because it was easier, and there is nothing specific. You should follow the same guidelines of everybody. If you think you're being exposed, or if you think you're experiencing symptoms, just get tested, like everybody. So do not wait because you have a Raynaud's or because you're taking some medication for Scleroderma. And testing follows some specific routes according now to where you are in England, and so you can talk with your doctor, or you can just dial the 111, which now is 119, I think, and get tested to the standard route. If at any time they do start to make available this quick testing that we've been hearing since April, that is another good thing. Just go there and get tested. The one point I wanted to make is that if you happen for any reason to have a face-to-face appointment with your GP or with your specialist, rheumatologist, there is now in the NHS the possibility of being tested for antibodies. And if you think you may be, as you may have been exposed in the past to the virus, this antibody test is just a blood test and will tell you whether you have antibodies against this COVID, which will mean that you had a previous exposure and then you passed the infection. We don't know if that means that you are completely immune from any other exposure in the future, but surely it would be a positive to know that at one point you met the virus, you made antibodies, so at the worst, if you meet it again, you will not realize. Now, a lot of questions, and thank you, SIUK, to summarizing your question into key points. What about the risk level? And could go around of what are the risk levels for different types of scleroderma? Is there a greater risk for those with lung involvement and PAH? Is there a greater risk for those on medication? Now, I will answer these three questions by explaining a bit what are the principles that drive my answers and the answer of the scientific community. It is crucial also to answer questions that you might have tomorrow to understand what is the risk in COVID, this risk of infection versus the risk of complication. Infection is an infection like by any other virus. This is particularly contagious virus, like any other cold virus. And an infection does not mean severe complication. So risk of infection is not dependent on the type of scleroderma or Raynaud or the medication. At the moment, the risk of infection is rather driven by where you live in the country. This is a map published by the BBC a couple of days ago. And the gray areas are the areas that are more or less where we were in June or July. The blue areas are the areas that are driving this rise in infection rate that you've seen. So if you are in any of these blue areas and you have the test and trace up, you will have on your screen that there is a high risk of infection. That means that there is many people around you with the virus, and there is high chances of contracting it if you don't use all the precautions. It is important to avoid infection because while we assume COVID-19 being a very bad complication, a very bad complication can only come if you get infected. So avoiding to get infected, of course, will avoid any risk of complication too. Now, and you hear masks. We all know which masks not to wear, do we? But do we know how to handle our masks? This little piece of tissue or a paper or any material you have your mask with are now part of our life. We've seen them only very seldom before this pandemic in the airport of some people from Asia wearing them, and now they are part of our life. Now they're there to shield our nose and mouth from the virus. That means that once you wear that mask, if that mask has fulfilled its purpose, has the virus on it. So if you went to shopping, or if you went anywhere and you wore the mask, if that mask has protected you, the virus is on the outside of the mask. And that is the principle to keep always in mind on how to handle the masks. There are many do's and don'ts on the on the internet, and this is one that is used in most hospitals in the States. Let's not focus on the do's, but on the don'ts. It's simply all the don'ts are driven by this purpose, by this principle. Virus is on the outside part of your mask, so it doesn't make sense to wear a mask with a hole. I don't know if you can see my arrow, but I think you might. It does not make sense to wear the mask below your nose. It does not make sense to wear the mask loose on the side or to touch your mask. And this is what I keep saying everywhere. People that just adjust their mask, or they take it down a second to talk and then they put it back where the virus is on their hands. Or people that take it out, put it somewhere, and then go and grab it again. So it simply does not make sense. Instead, you should touch the mask only from the sides. If they're reusable masks, you should throw them every time you use them and wash your hands afterwards. If they are single-use mask, disposable mask, if they're reusable mask, you should be particularly careful in the way you handle them and wash them very often. So this is just common sense, it's not medicine, but I see a lot of misuse, so I thought it was worth to spend a couple of minutes. Shielding is the best way to prevent infection. I will discuss that in a few minutes. Now, first I wanted to share a couple of slides on what happened if shielding didn't work or the mask didn't work and you get infected with this virus. Some of you may have gone through this very interesting experience of having somebody swabbing the back of your throat and nose with the same swab too, not very nice. But what happens if you get infected? It is all about how is your heart and lung function and how is your immune system health. If there are no issues in the way your heart and your lung are working and in your immune system, 99% of cases they just go through a very mild infection. On the contrary, if there is anything affecting any of this, then there is an increased risk of complication that now have of COVID-19, which are also called just COVID-19, which unfortunately brings some people to hospital. So keeping this in mind, let's answer quickly one of the questions. What happens with Raynaud's? So if you have Raynaud's, it can be as bad or as mild Raynaud can be, or if you are on any medication for Raynaud, whatever medication it is, you do not have an increased risk of complications. The infection, as I mentioned, it just depends on where you live and if you manage to use your mask properly or you get in touch with somebody infected. But having Raynaud's or taking medication for Raynaud will not increase the risk of complications or your chances of going to hospital. Now, why this is not the case sometimes with people with scleroderma. As I mentioned, the virus gets into our system through the eyes, through the nose, and through the mouth. Most of the cases through mouth and nose. And when the immune system works properly, the virus is stopped there. It doesn't go any further. And this is why the majority of people have just symptoms that are related to mouth, throat, and nose. On the back of our nose and mouth, there are some immune organs, the tonsils and the adenoids, and those are there exactly for this reason, to stop viruses to go any further. So the symptoms are the one of the common cold, you can have fever, and that is why there is loss of smell and taste, because this virus can actually affect the top part of the nose. You can have sore throat, dry cough, and this is happening in 99% of cases. People with any autoimmune diseases, including scleroderma, because of their condition, may take some immunosuppressive drugs. And this includes cyclophosphamide, mycophenolate, methotrexate, and make sure just I'm not going too much over time, or other drugs. And the purpose of this drug is to reduce the activity of the immune system, because these are autoimmune diseases driven by an overactive immune system. Of course, as a side effect, your immune system is weaker and might not be able to shield the virus at the level of nose and throat. And the virus can go further to the lungs, and that's where you have pneumonia. Now, we need to understand that pneumonia for the virus does not necessarily mean also to be hospitalized. In the virus, the functional, in the lung, the functional element of the lung is called alveoli, these little air sacs. And we have 600 million of those, enough to cover a tennis field. And these air sacs are there to exchange oxygen from the air into the blood and carbon monoxide, which is our waste gas, from the blood into the alveoli, into the lung, and from the lung out. Now, when the virus reaches there, the immune system, like it does in the nose and in the throat, is trying to fight it and causes an inflammation. And inflammation comes with fluids, the same that you have in your nose and throat, and that causes pneumonia. Now, of course, if your heart and lung function are not 100%, given the same amount of virus that gets to the lung, you might have a more severe pneumonia. Now, this is often the case for people affected by scleroderma. There are 40% of patients altogether with scleroderma that have some form of lung involvement. And this can be interstitial lung disease or lung fibrosis, which is scarring of some part of the lung, or pulmonary hypertension, which is increase of the blood pressure in the lung, or sometimes a bit of both. And what happens? In case of lung fibrosis, there is a reduced lung volume. So this number of functioning alveoli is reduced. And you talk with your doctor how much that is reduced. In case of pulmonary arterial hypertension, there is a reduced blood circulation. So the blood goes around the alveoli, does not flow as it should. In both cases, the effect is similar, which is a reduced gas exchange. So if there was a pneumonia affecting 10% of your lung, but another 10% was affected by scleroderma, you'll have a pneumonia that was twice as severe, and 20% equivalent. And this is the bottom line of why having lung involvement increases the risk of severe pneumonia. The further complication is that when the proportion of lung affected is higher than 30 or 40%, the immune system really gets on the alert and is trying to fight this infection with all the strength it has. First of all, you need oxygen, but then you're at risk of having this acute respiratory distress syndrome. So a very severe pneumonia, because the immune system is trying to get rid of the virus. And that's why, paradoxically, in people that get to this stage, we use the same drug that increase the risk of complications, so immunosuppressive drugs, to try to calm down the immune system and let it go through the infection a bit slower with oxygen, but without harming the lung any further. Now, these are the two principles to keep in mind. So heart and lung function, and that is why other factors like age, hypertension, diabetes, obesity can influence COVID-19 complication, because somehow they influence either the immune system or the heart and lung function, and I don't go into details. So what are the shielding guidelines? Who should shield? There are some basic principles, and here at Leeds we try to summarize them in a quick questionnaire for patients that is based on the BSR guidelines that you see published on the SI UK website. Let's see if I can share this link. Interesting. There we go. We should be able now to see this. This is the for patient part of our website. There is a COVID-19 guidelines for patients here. And let me make it a bit bigger. Here it is. A bit of technical glitches. So, do you take 20 milligrams or prednisone? So these are the questions. Are you taking any medication? And people here can either say yes, and they are directed directly to say, okay, you should shield, or no. And so any other medications. And this is the list of medication. You can just check it with the medication list that you have. Again, if you answer yes to this question, you are directed directly to the shielding guidelines. Or if you don't take any medication, there's another level of risk here. Can you answer yes to any of these questions? Are you more than 70 years old? Do you have lung fibrosis, which is also known as ILD, or pulmonary hypertension? You have kidney disease. This is because it's affecting the heart function. Ischemic heart disease, high blood pressure. So specific question that then patient can answer is no, and in this case, it should just have all the precaution. This was what it was said back in the summer, if you remember, it's not changed. Or yes, and then you should shield. So to tailor whether you should shield or not according to what you have. Now let's go back to where we were. Now, the last series of questions SI UK received was, what do we know about the potential impact of COVID-19 for the people with diffuse or limited systemic sclerosis? That is the $1 million questions, as they say. We don't know, and these are open research questions. Here in Leeds, we have some research. It's research going all over the world, because what we're trying to learn is whether there is an impact of the infection, how mild or severe it could be, on the lung progression in scleroderma or on the overall immune activity. There is few theories suggesting that virus infection can actually trigger and worsen autoimmune diseases, and COVID is one of those. We cannot answer this question yet. These are open research questions, and we have studies to do it. We will know more in the next 6 to 12 months. With this, I close this 18 minutes. I thank you. You know how to get in touch with UK if you are on this webinar. Will also be a link for the Leeds Scleroderma website if you want to answer the shielding guidelines. And now I guess it's time for some questions.
Fantastic. Thank you very much for that, Francesco. That was very insightful. I'd like to now take this opportunity to ask every one of our attendees to hopefully put forward your questions to us, so that Francesco can then provide his expert answers. So if you hover over your Zoom application on your laptop or mobile device, you should be able to see a Q&A section, and there you will be able to add in your questions. So I'll just give everybody a bit of time to try and add in their questions.
So let me start and say there is, if you don't find, oh, here, there is one. Let me put here for everybody the link to the shielding guidelines that I mentioned in the presentation.
So the first question we've had come in is from Elaine Clegg. Thank you for that question, Elaine. And Elaine has asked, should systemic sclerosis patients have a pneumonia vax?
Yes, so pneumonia vax is a vaccination that is offered every year, and it is just a good vaccination to have. You might need to consult with your doctor for the type of immunosuppressive drug you're on, because some of these vaccinations may not be completely indicated, but in general, you should have it, yes.
Thank you, Francesco. We've had more questions come in, so please do keep these questions coming in. There's another question that's come in from Ellie specifically, and Ellie has asked around the medication of very difficult to pronounce.
Hydroxychloroquine.
That's the one. Thank you, Francesco. And she's asked. She stated rather that she takes it for scleroderma, but she doesn't know if it will benefit her or not if she were to contract COVID-19, which hopefully she doesn't, of course.
Yeah, of course. So first of all, and I understand the reason of this question. There has been a lot of talking on the media about this hydroxychloroquine, but in this country and on the other side of the pond by the US president. So hydroxychloroquine is also a mild antiviral. And first of all, it does not increase the risk of complication for COVID. So if you're taking just hydroxychloroquine and you don't have any issues in your lung function, you've been told not to shield. You don't need to shield. You just need to follow the normal guidelines. Is it effective to prevent complication of COVID? Well, there is a scientific rationale that it should. There are studies that have shown that when people get to the hospital and they start to need oxygen because of severe COVID, hydroxychloroquine is not doing much. And these are just the first couple of studies that are coming out because people were thinking that it was this super drug. So it's not a super drug. It might help a bit to get to the level of going to hospital. Unfortunately, if you end up being hospitalized because of COVID, we know that it's not going to make much of a difference. But it doesn't hurt and doesn't increase the risk. So definitely stay on.
Thank you, Francesco. So we have had a large number of questions come in. So I do apologize if we don't get the chance to go through each and every one of them. We have had a question coming from Agnes. Thank you, Agnes. Agnes has asked the question in relation to her risks, her risk category. She says that she has severe pneumonia, and she had that in January, and her CT scan showed some abnormality. She says she has limited scleroderma, and she takes nifedipine and hydroxychloroquine, and she was asking about her risks in relation to COVID-19.
Yeah. Okay. So it all depends on this CT scan results. The fact that you had a severe pneumonia in the past does not make much of a difference. It depends how you recovered from there. If at the end of this pneumonia, and because of scleroderma, your overall lung function is more than 70%, so your relative risk of every complication is not higher than other people if you're not taking specific immunosuppressive drugs. So but in general, if you have some sort of lung involvement, you should consider yourself at a slightly higher risk of every complication.
Thank you, Francesco. We have another question that's coming from Pat. And Pat goes on to say that she lives in a relatively safe area, and she has mild PAH. Should I be shielding, or is taking extra care sufficient?
Okay, so first of all, lucky you, you live in a relatively safe area, which is good. Now, it depends how mild is this mild. Yeah, again, there is no fixed threshold, but the common sense threshold that we have with all patients is 70% of your lung function. If you have less than 70% of lung function, you should start to use extra care. And when people have around 60 or less than 60, then I'm strong with my patient to say you should shield or be extremely cautious. Now, shielding when we were in proper lockdown was different than now. Now if you have kids, they are going to school. And so the entire concept of shielding is a dynamic concept. So talk with your doctor, check how much is your lung function, and if it's really mild, then you should just use extra care. If you have some moderate PAH, then you should shield.
Thank you, Francesco. We've had a great question coming from Lorraine, one that I think would really benefit the whole community. So Lorraine's asked, should I still be receiving yearly screening, LFT, echo, etc., for her systemic sclerosis, and blood monitoring for her immunosuppression?
Thank you for this question, Lorraine. Yes, you should. Now, yes, you should doesn't mean that the system is able to offer that. We have been redeployed in May, also the rheumatologists to the COVID wards. This is not happening yet at this stage, but overall, the way we have been delivering care to our patients has been completely disarrayed. So we are all facing these huge backlogs of patients that are due for their follow-up, and we cannot offer the follow-up because we are streamlining the people coming to hospital, because we are screening only people that are negative, people coming to hospital. We have social distancing in the hospital, so we can see only 20% of the patients we've seen before. So this said, yes, you should receive it. Now, what we are doing here in Leeds and in most of other trusts is that we are prioritizing people that we think they are at risk of progressing because they have symptoms of worsening or because last time we checked they were in natural progression. We are prioritizing those to have their lung function. The pulmonary function tests were stopped throughout the country for a few months, and now they're starting because they generate aerosol by the way you actually do the test. We are back in doing those, and it will be your consultant to prioritize over your symptoms and over what level you were before. If for the past 2 or 3 years you had 80% of lung function isn't been stable, you will be in a low risk, so you will be asked to come as soon as the system is catching up.
Thank you very much for that, Francesco. So now we've concluded with part 1 of the webinar, and we'll be shortly moving on to part 2. But first and foremost, I'd like to say a big thank you to you, Francesco, for your fantastic presentation. A lot of great insight, which I am sure the attendees would agree with. And thank you also for answering those questions and providing your expert opinion. I know you'll still be waiting in the background during...
Yes, and I'll try to type some answers for people that we didn't make to answer live.
That is absolutely fantastic. Thank you very much for that, Francesco. So now we move on to part 2 of the webinar, and I'm very delighted to be joined by our expert speakers, Louis Horsley and Jesse Kunitz, and they will be focusing on the question, how to get the most from your virtual appointments. And again, the agenda for part 2 follows the agenda for part 1, in that the second part of the webinar is split into 2 parts. The first part is a presentation, and the second part is again a Q&A opportunity. So I'm hoping to be joined by both Louis and Jesse on camera very shortly. Hello, Louis. Hello, Jesse. How are you both doing?
Thank you.
Good, thanks.
Good to hear. Good to hear. So again, without further ado, I'd love to hand over to you, Louis.
Great. I'm just going to share my slides, and we'll kick off like that. Can you all see the slides?
Fantastic, fantastic. Thank you very much, Louis.
Perfect. Hello, everybody. So I'm Louis. I work for Traverse, and I was one of the researchers on the project that we did called The Doctor Will Zoom You Now, which is getting the most out of the virtual health and care experience. And I'll let Jessie introduce herself.
Thanks very much, Louis. Hi, everybody. Good morning. Thanks for having us here today. As Louis said, my name is Jessie, and I'm Head of Health and Social Care at Traverse. Just for a tiny bit of background, Traverse is a social research organisation. We specialise in public engagement, research, evaluation and consultation. And we were delighted to do this particular piece of work in partnership with Healthwatch and also National Voices. We're going to tell you a bit more about the work, who we spoke to, what we heard, and to share with you some of the insights that people have given us about how to get the most out of this very new way of receiving care. So thanks very much, and I'll pass back to Louis.
Great. So just as a little bit of context, we spoke to about 69 people who'd had a remote appointment during lockdown. And as Jessie mentioned, these were recruited via local Healthwatch groups. The people who took part were relatively ethnically diverse, but more skewed towards older and female. This is just a little bit of a summary of what people said they felt when they were told that they would have a remote consultation. So you can see it's a mixture of some people feeling relieved, some people feeling anxious, disappointed, and it's just to show that there's quite a mixed picture. In terms of some themes, so I'm just going to run through some of these headline themes, and then Jessie's going to go in a bit more detail. So we looked at boundaries, about respecting people's time, the quality of personal communication, preparation information, choice, so how people communicate, the test, learn and improve approach, how you should be as inclusive as possible, and then opportunities for improving the system, which we'll go through in a little bit of details. Jessie.
Thanks very much, Louis. So as Louis said, we identified a number of themes that came through from what people told us. And we were particularly talking to people to share their experience and to try to learn from their experiences. Touching on the first one of those, was this idea about boundaries. And what many people talked to us about was the fact that they they found the idea of remote consultations pretty positive. It felt like a safe way to get the care that they needed during this difficult time. But what people really didn't like was the idea that they might have to sit around and wait for the appointment, not knowing quite when it would come, kind of watching the phone and waiting for that call to happen. People talked about needing to take respect for the boundaries that they hold in their lives and to be able to know when that appointment was going to take place so that they could be in a good space, which was private, that they could be confidential, and that they would have the opportunity to talk about things in the way they wanted to talk to them. And we've offered up here a number of the different quotes that people have given us, and some of those you might find are reflective of your own experience, and others might give you some ideas about things that happen to people and what you might do if it happens to you. We'll be sharing the slides afterwards, so if you don't get time to read them all now as we go through, you should get the chance to read them afterwards if that's interesting. So yeah, boundaries was a really good thing. The next one, I think, is a really important one. And I guess this is very much a message that we heard, and that one that we recognise is not really just to do with remote or virtual consultations, is the idea that, you know, quality personal communication matters no matter what. But what we did hear is that in the remote consultation, whether that's by phone or by video, sometimes people need to think about the way they communicate, perhaps more clearly, taking more time, making sure that information has been understood, and really just making sure that people got what they needed from the experience, actually, and that was done through good quality, good communication. Next one. A really important thing that people talked about was the need to take the time to feel prepared. People said that they would really have liked to have got some information in advance to be able to know what to expect, and if it was a video call, perhaps to be able to try it out, have a bit of a practice. Bearing in mind, we did this research during the middle of the kind of most difficult lockdown phase, and for many people they'd not been online before, or they hadn't used video calls very much. I think now we're all getting pretty practiced at it, but at the time people said, you know, I want time to be able to prepare, to have a go, to practice, to know what I'm doing. The other side of that was around preparation. What can people do in advance to make sure that they feel able to ask the questions they need to ask, to be able to take the time they need to get what they need out of the appointment. So also being prepared in themselves, you know, am I in the right space? Have I got my head in the right space? That links back perhaps to the first point about boundaries. These two are really connected. People needed the ability to be able to be in the right frame of mind. And when we go to an appointment at a clinic or a practice, we take the journey, we're there, we're in the waiting room, and all of that is a part of our preparation for the actual appointment. And online or by phone, that bit often doesn't happen. So taking the time to prepare yourselves in that way. Next one then, Louis. Yeah, choice. So this was a really important message. And in a way, this reflects back to the slide that Louis showed with the range of different emotions. What we found is that lots of people have different experiences, and depending on the need and depending on the type of person and the type of situation, the choice of the way you need the appointment to take place is really important, and it won't always be the same. One of the really strongest messages that we heard is that we need to be able to identify what works best, given the person and given the situation. In many ways, people actually talked about the ideal situation being the opportunity to have a blended approach. Mm-hmm. So at the start of a situation, you know, it may be that at the beginning, what people actually need is a bit of an online chat, not by phone or by video, but using text, just to ask a question, check something out, set something up. Perhaps following that, a phone call. If necessary, maybe there's the need to jump online and be able to see each other. And actually for some situations, it's really important to recognise that being at a distance is not right, and the only way forward is to be able to see people and to sit in the same room together. And that was to do with all sorts of situations, but particularly around handling bad news or complicated and difficult information. But a really strong theme there about choice and the ability to be able to meet with and talk with your healthcare practitioners in the way you need to do that. Thanks very much, Louis. Last one from me before I hand back to Louis. We heard lots of messages about the ability to test, learn and improve. And by that, one of the most interesting things to learn from our research actually is that of all of the people we spoke to, only 3 people were actually asked to give their feedback. For us, this presented a really missed opportunity for the way video, telephone and remote appointments take place to be improved based on what we learn from the experiences of people that are having them. Because what we also heard is that through our research, people gave some really great ideas. So there is a wealth of information and feedback and ideas available from people like yourselves using services. And the best thing to do is to be able to share that so that people developing and improving and putting into place the systems that actually holds these remote appointments can learn from that, and they can improve based on your experiences.
Yeah, thanks, Jessie. And just to build on that, it's also the idea that even though the way that people are now having consultations is kind of in response to an emergency, it also provides an opportunity to, you know, some people were really happy that you could have a remote consultation. They didn't have to, you know, drive their parent to the hospital and pay for parking, for example. So we had one woman who said they'd had the best physiotherapy session they'd ever had as a phone call. So they couldn't see or be touched by the physiotherapist, but it was just because they had that one-to-one interaction, and the intention was put on this one person. So there are some interesting elements that come out of this as well. In terms of the digital inclusion thing, it's important to acknowledge that there is a big proportion of this population which is digitally excluded, either because they don't have access to the internet, or they have low levels of digital literacy, or because they choose not to engage online. And that people who choose to not engage online cuts across a lot of different age groups as well. But the main takeaway here is that we recognize there's a connection between people who are unable or unwilling to access remote consultations and people who are experiencing health inequalities. So older people or people with disabilities or specific communities or those with lower incomes are disproportionately negatively affected as well by the move to remote consultations. But like I said, technology can be a really big enabler. So it's about the intention, and it's about providing the range of options and empowering the end user ultimately.
Back to me just very temporarily. So one of the things that we heard is some great ideas about what we can do to improve services basically, and there are just some really good examples at the bottom there in terms of some really quite different things. So meeting people online creates a great opportunity to share links to information, look at images together. There's the opportunity perhaps to record sessions so that you can hear them back later on, so that you, if there's complicated information, you can revisit them. And we also heard some great ideas about this different way of communicating being an opportunity perhaps for patients to take a more equal role in the care, whether that's by sharing records, seeing information. But generally what people reported was that actually meeting online with a healthcare practitioner often felt like a more equal relationship than perhaps when you are in a consultation room. In a consultation room, it's often an environment in which it feels alien or different for us as users, and we feel like the visitor in that space. Whereas online, it's the same space. We're in it together. We're in our homes. We can feel comfortable, and that actually increases our confidence in many ways.
Yeah.
Passing, I think, back to Louis. We were just going to share with you some top tips and some things that we picked out of the research for people to take away and to think about to make sure that you get the most out of this whole new experience. So pass back to Louis, and then I think we're going to do questions.
Yeah, so I mean, this is a lot of information in 15 minutes. And as we said, we're really happy to share these slides with anyone who signed up. But this slide here is important because it acknowledges that the people who took part in the research had some tips for their experience as patients, and also some recommendations for what health and care professionals could consider. And it just talks to that kind of power balance that Jessie was mentioning So stuff around asking for time slots and some more practical administrative things. So some people were told, you know, you're going to be contacted tomorrow and not given any particular time slot, which is difficult for people who are working or have children, etc. With starting that with the phone call, if you're not confident with video technology, is an interesting one as well for patients. So it's about having a kind of that option to decide how you're going to engage and introducing yourself by the phone, which might be a medium that you're comfortable with. And then if you feel like it would benefit from it, having access to video consultations, for example. And then further down that spectrum is about, you know, potentially asking your practitioner to share images or kind of information of your own records that you could find valuable as well. And then the kind of final point here on the bottom left there around not all appointments are suitable for remote consultations, and that's important to acknowledge. And it's important that people feel comfortable to say that. And I think that goes for both the patient and the healthcare professional. I'm sure healthcare professionals don't feel comfortable having remote consultation in all circumstances. I think that's going to draw us to a close. Just to say that we do have an easy read version of our report, which is available also. We're happy to share the link for that. It's the same content, but in a more accessible format. And we just wanted to leave you, before we head to the Q&A, with these two questions as well for you to consider, which is how do we ensure that we don't leave people behind and further deepen health inequalities? So that talks back to some of the demographic situations that I mentioned earlier, as well as people who don't or have access to the internet or don't want to. And then what are the opportunities for patients and healthcare practitioners from this new form of communication? So if more consultations are going to be remote, what's the opportunity for patients and practitioners to come together? And that's it for now. I'm going to stop sharing my screen so that I can see everybody.
Fantastic. Fantastic. Thank you, Louis, and thank you, Jesse, for really going in depth with that fantastic presentation. A lot for our attendees to take from that presentation. So a huge thank you. And now, of course, we are moving on to the Q&A aspects of part 2. So again, I'd like to take this opportunity to encourage everybody, all of our attendees, to please put forward their questions on the Q&A section of the app. And then I'd be able to put these forward to both Jesse and Louis. And also Francesco's still in the background, so if there are any questions that are have more of a Raynaud's and Scleroderma focus, then he would be able to give his expert opinion there as well. So please do send in your questions. I guess let's give it a few moments for everyone to send in their questions.
Sure. And just to clarify, so I don't come from a medical background and Jesse doesn't either. We both come from a kind of patient engagement background. And the people who took part in the research took part in like people who had a range of different healthcare experiences. So outpatient, mental health, A&E and
GP practices.
GP practices. So we weren't specifically asking people to share the reason why they had engaged with the healthcare services, but we did ask what was the reason for it.
We've had a question come in from Charlotte, and I think you've already answered that question in some ways, Louis. So she just asks. Thanks for that question, by the way, Charlotte. But she just asks. She says, first and foremost, thank you. It's been very insightful. And she just asks if it's systemic sclerosis specific, but of course, you've already gone over that somewhat. There is a question again from Charlotte, and this one is actually posed to Francesco. And she's asked to Francesco, how have you found conducting virtual consultations with patients? So Francesco, if you haven't already, I might just get you to...
I'm here. So thank you. That first of all, thank you for these presentations about the virtual. It's very useful, and I learn a bit. It's because I'm on the other side of the camera. So yes, I found it useful. We have above all for triaging of digital ulcers. We have a digital ulcer clinic here that runs in Leeds, where we see patients, and sometimes the ulcers require attention, and sometimes they require some regular dressing. So we have these video consultations, and the most useful part are exactly when a patient is not sure. This came up on my finger. Do you think it needs debridement? So where is something that adds to the telephone and maybe gets triaged. And we have 15 per week, and we end up calling in only 1 or 2 patients. So that has been useful. As far as other aspects of scleroderma, their video or phone, the added value of video is that I can see the patient and patients see me and they feel more engaged, but there is not direct clinical gain. But for digital ulcers and carcinosis, there was actual also clinical gain. So we have these video consultations.
Thank you, Francesco. So we've also had a question coming from Celia, a very interesting question. Thanks for your question, Celia. Celia, first and foremost, said that she found the presentation very helpful. And she's asked, posing this to both Louis and Jessie, have you shared these top tips with GPs and hospital consultants? I'm guessing Celia feels these are amazing tips and ideas, and she's trying to find out if they have been translated to the GPs and hospital consultants.
Great, I can pick that up. So Celia, yes, they have. We were really fortunate that the NHS England Chief Exec Simon Stevens linked to it in a letter that he wrote out to the whole of the NHS just towards the end of the kind of biggest part of the lockdown, really. And within that, he suggested that people take a look at them. So that was a really good thing, because I think it gave people the opportunity to see them and to see how they might use them in their practice. The other area that has happened, which has been really helpful, is because we worked in partnership with HealthWatch. You may or may not be aware, but there is a HealthWatch in every area around the country. And so many of those HealthWatch organisations locally shared the top tips with all of their practices and with their contacts in the local area. So hopefully it also went out that way. But if it's something that you think would be helpful to have in your practice, I would recommend you take it to them and show them and see if they could put a version up, or we deliberately left it so that people could create their own if they preferred. But yeah.
Yeah, and I think also just to add to that is, so we work with the NHS on a relatively regular basis, and there is people asking us to kind of expand on the work that we've done already, because there's a real interest in it and people see the value. So yeah, I think the message is kind of, it's going downstream, across stream and upstream as well, which is good.
Thank you for that, Louis, and thank you, Jessie, because that does make a lot of sense. And as you said, they can provide their GPs and their consultants with those tips, and I think that would definitely go a long way to bridging the gap and ensuring those meetings are up to standard. So thanks for that question, Celia. We've had a few more questions come in, so I do apologize if we don't get the chance to answer all of these questions. We've had a question come in from Edith. Edith has asked, is it likely that some of the strategies developed during COVID will become routine in the future? Will this experience change future practice?
I mean, to respond a bit to that, but I suspect Dr. Francesco Delgado might also have a view on it. But
yeah,
I think inevitably, I think that this will introduce a change that will have an effect into the future. I think the introduction of digital and remote appointments may be the biggest change to the way health and care can be provided.
I agree. So we were pushed, as a very hard situation, it sometimes causes a benefit. we have now a camera in every NHS office, which if we asked last year, we would have been laughed at. So above all, for a reference center here, like Leeds, where patients sometimes travel 3 hours to come here, and I think we will be using video consultation after this nightmare is over to sometimes prevent a trip or to triage an appointment. Do I really need to see you in person? So yes, I think we will learn something from this, and the system will change a bit.
Thanks for that, and thank you for also adding in there, Francesco. I know that you have some other commitments, so I want to.
Yes, I'll take the occasion to thank you. I think it's a great initiative that you had. I hope the patients find it useful. I found it useful when I was the listener and not the presenter. So thank you, Louise and Jessie. And yes, I have to leave. I hope I answered all the questions directed to me. I'll be happy to answer offline if there is anybody. And bye to everybody.
Thank you very much.
Nice to meet you, Francesco. Bye.
Bye.
Thank you, Francesco. So now we have a few more questions that have come in, and we are entering into the last few minutes before the Zoom webinar finishes. So again, I do apologize if we don't get the opportunity to answer every question. We've had a question coming from Rachel Finney. Rachel Finney goes on to say, I have a routine cardiology appointment this month for an ultrasound. I think actually, okay, so I have a routine cardiology appointment this month for an ultrasound. Obviously, this can't be done remotely, but I am worried about attending hospital. I have not been sent any information about what measures are in place. Should I just attend as normal, or is there anything I should do to prepare? So I think, what do you think, Jessie, or is this a question that's more inclined to Francesco?
Well, I think the technical side of things would be more inclined towards Francesco. But what I would say from a completely non-clinical perspective, because to be clear, I don't have a medical background, but as a fellow person, I would say I would give them a ring and ask them what they've put in place. And I would ask them to tell you what measures they've put in place, and then for you to then take an informed choice about whether you feel that's enough. Because ultimately only you can know, and only you can feel whether or not that you feel safe, and weigh up that judgment. But I think that the only way you could get close to that is to actually ask them, and they should be telling you, and it's appropriate that you ask.
Yeah, empower yourself.
You know, that's a very good approach. Thanks for that, Jessie. There has been an interesting question or suggestion that's coming from Ellie. So she's suggested that during the period where we've now moved into remote appointments, she's asked about the possibility of having a remote appointment either at the patient's home or at the consultant's home. I just wanted to get your opinion both, because this is somewhat out of the norm of a remote appointment.
I think maybe, Ellie, what you're suggesting is that you have somebody there to come with you, either because they're with you in your house, or that you could potentially have a three-way video call, so that you've got a carer, somebody there, not as a carer, but as a supporter. And I have to say, I think with it came up quite a lot with the people that we spoke to during the Dr. Will Zoom You Now research, and quite a number of people talked about having somebody with them felt really reassuring. And I think, yeah, just as if you were in real life, having somebody with you, even if you're just on the phone, you can put it onto speakerphone so somebody else can hear what's being said. Often if you're getting a lot of information, it's hard to process it. Having somebody else there who you trust to perhaps take notes or to help you remember what was said afterwards, I think is a really good idea. And I think it's just as useful when you're doing it by phone or by video.
Yeah, and there's two sides. There's kind of a bit of a spectrum to that. One is, you know, we had some people who just asked their nephew to help them with getting on Zoom or getting on whatever video call system they were using. But then there's also, in some of the work that I'm doing at the moment, it hasn't been released yet, we're talking to people who use a third-party British Sign Language interpreter to get on a video call, and that's providing some direct translation, which would not be a possible otherwise. So there's a spectrum, but I think, yeah, ask for help and have someone in the room if that helps.
Thank you both. We've had a comment coming from Sarah, and Sarah's just said a huge thank you and really great presentations and Q&A. So I'm very glad we've had a very positive impression on Sarah, and I'm sure on all of the other attendees. And of course, as we've come to 11 sharply, I'd like to take this opportunity to say a huge thank you to you, Louis, and also to you, Jessie, for the level of depth, for your time, and for the amazing insight. It's been hugely appreciated from us internally at SRUK, and I'm sure by absolutely everyone that's attended. So a huge thank you. And I'd also like to take this opportunity to thank all of the attendees for taking their time to watch. I hope you've gained a lot of value, and for also taking the opportunity to engage and make the webinar what it is. And of course, by asking questions, you're allowing all of the other attendees to benefit. So I'd like to say a huge thank you to both parties. So thank you, Louis, and thank you, Jessie.
Thanks for having us. You're more than welcome. And we're happy to share. I think you've got a copy of the slides anyway, so feel free to share those out.
Definitely.
I was just going to say, I'll post a link in the chat as well that just has the links to the easy read versions and things.
Okay.
Fantastic,
great.
Fantastic. We will again put this out in future posts, and we'll make sure all of the links are attached and slides and so on and so forth, so everybody doesn't miss out on a thing. But otherwise, I'd like to wish everyone a great Friday and a lovely weekend ahead. And do take care, everyone.
All right. Thanks a lot.
Thank you very much. Take care. Bye-bye.
Bye.